Uh, Many kids wheeze as babies, and we use the term bronchiolitis. What does bronchiolitis mean?
Bronchiolitis is really a very general term for inflammation in the airways that tends to cause small airway obstruction, and it can be due to a variety of different causes, the most common of which probably is a viral infection.
Okay, and there's one particular one that most kids get, and you can talk about that most commonly?
The most common one that people talk about is respiratory syncytial virus, or RSV. But over the past several years, there are a lot of other viruses that have come into play. For example, rhinovirus is one that previously we didn't regularly test for, but it's probably becoming a little bit more important than most people had anticipated.
Even the common flu could be triggered, is that true?
Yes, that's true.
Since you mentioned RSV, every kid under the age of 2 will probably get RSV. Some will be mild, some will be severe, and some of them get very sick. Who's the high-risk group with RSV?
The high-risk groups are children with pre-existing lung conditions, for example, children born prematurely, children with congenital heart diseases, children with immune deficiencies. But to be honest with you, there are a lot of genetic factors that we don't quite understand right now that make some people much more susceptible to severe RSV infection than other children, and that's something that we don't completely understand right now.
Very timely premature, we actually give a vaccine on a monthly basis during the high-risk months, is that true?
Yes, the trade name is Synagis, and the generic name is palivizumab, and that's something that helps to prevent this type of infection for high-risk children.
And is it very effective?
It is. It's something that really has decreased the hospitalization rate for a lot of children, particularly those born prematurely.
And after getting this RSV, many kids act almost like an asthmatic. They end up wheezing, frequent attacks.
Yes.
Do you know why?
Again, that's something that's not completely understood right now. There are some people who believe that the virus itself predisposes one who is infected with it to develop asthma later in life, and there are some people who believe that people who are prone to asthma become more susceptible to becoming infected, and it's very difficult to sort some of those things out. As I mentioned before, there are some other viruses, particularly rhinovirus, which seems to show a very similar pattern, and perhaps even more so than RSV as far as the development of long-term asthma.